Hi, I'm Dr. Suchitra. In this session, I'm going to talk to you about gout and CPPD, that is calcium pyrophosphate deposition disease, or what used to be known as pseudo-gout. Gout was considered a disease of kings. Alexander the Great, Henry VIII, Isaac Newton, Leonardo da Vinci, Charles Darwin, they all seem to have had gout, and many more. So it used to be a disease of kings and the elite educated class. But no more. It's now a disease of commoners, really. It is an inflammatory arthritis, and the crystals, that is the monosodium urate, MSU crystals, deposit in the joints and cause arthritis. So it's an inflammatory arthritis. It's actually one of the most common inflammatory arthritis in many places, all over the world. Urate is the end product of purine metabolism. And humans and some primates lack the enzyme called uricase, which converts urate to soluble allantoin. Only humans and some primates don't have uricase. This causes a problem when we try to study gout because there are no animal models. That is, most of the animals have uricase, and even those primates that don't have uricase, they are vegetarians. So it's difficult to study gout. And when they try to create mice which do not have uricase, those mice ended up dying of renal failure rather than developing gout. So it's been a difficult disease to study. The prevalence of gout is increasing. That is 2 to 3-fold increase in the last 20 years. The prevalence is about 1 to 4% now. The increase is attributed to many factors. One of them is lifestyle change. That is, people are consuming more sugar-sweetened sodas, fructose-rich foods, which all contain a lot of purines. And alcohol, especially beer, has a lot of purines. And medication use like diuretics have also contributed to the increasing prevalence. And obesity and other factors as well. Hyperuricemia is defined as uric acid greater than 6.8. It is an independent risk factor for all-cause cardiovascular and ischemic stroke mortality. So it's not just gout. And it's an independent predictor of diabetes, obesity, and hypertension. So hyperuricemia itself is something to look out for. There are several criteria to diagnose gout, to classify gout: Rome criteria, New York criteria, ACR criteria, the American College of Rheumatology criteria that can be accessed in an app by the ACR, American College of Rheumatology. And the app also has gout management guidelines as well if you want to have a look. Gout is much more common in men in the ratio about 4:1. If you look at why that's the case, it's because estrogen is uricosuric. That is, women with estrogen excrete uric acid in the urine more. It's uricosuric. So women after menopause, that is when the estrogen effect is gone, is less, they seem to develop gout more than premenopausal women. So elderly women develop gout more. And the gout in elderly women seems to be slightly different from the gout in men, in that hands are more involved and they seem to be associated with diuretic use as well. And adiposity does contribute. You have to exclude secondary causes of hyperuricemia like malignancy, psoriasis, drugs like diuretics, and hypothyroidism. If secondary causes are excluded, then if it's primary gout, then the primary cause of that is under excretion rather than overproduction.